You did everything right. For 30 years, you saved, you invested, and you planned. You've imagined this moment 1,000 times. You're 50 years old, walking away from your desk for the last time, ready to finally start the life you've worked so hard for. But there's a trap waiting for you. It's a quiet financial problem that blows up more early retirement dreams than bad investments and market crashes combined. It's a 15-year gap, a chasm that stands between the day you retire and the day you can get on Medicare at age 65. This is the story of how a simple misunderstanding, not knowing how healthcare really works in early retirement, can become a total financial disaster. It's a mistake that can cost you hundreds of thousands of dollars, slowly eating away at the very dream you spent a lifetime building. Number 1. The healthcare cliff. The second you leave your job, your employer-sponsored health insurance is gone. It's a jarring feeling. Suddenly, you're standing on the edge of a financial cliff, and you have to find a bridge to get to the other side, to age 65. For a lot of people, this becomes the single biggest and scariest expense in their entire retirement plan. Your first thought might be COBRA. It's familiar, right? You keep the same plan, the same doctors, but here's the catch. COBRA is its own kind of trap. While you were working, your company probably paid a huge chunk of your premium. Now, you pay all of it, plus an admin fee. That could easily be over $8,600 a year for a plan that only lasts 18 months. It's a temporary and very expensive Band-Aid. So you turn to the main option for most early retirees, the Affordable Care Act, or ACA Marketplace. This is where you're supposed to find a real long-term solution. But as you start shopping, you get a nasty case of sticker shock. For a 50-year-old, a full-price plan can easily cost $10,000, $15,000, or even more than $20,000 a year.
And that reality just got a lot harsher. The enhanced subsidies from the American Rescue Plan and Inflation Reduction Act, which made insurance more affordable, expired at the end of 2025. Now, in 2026, we're seeing the painful result. Premiums have spiked, and the old subsidy cliff is back, meaning if your income is just $1 too high, you could lose all your financial help. A couple retiring at 50 could be staring at a bill of over $300,000 just to cover those 15 years before Medicare kicks in. Suddenly, your perfect retirement budget is in shambles. You might have saved millions, but you're facing a six-figure expense you just never saw coming. What went wrong? Number 2, the villain in your retirement plan. The big mistake people make isn't about how much money they saved. It's about not understanding the villain of this story, the one number that controls your entire healthcare reality. See, the Affordable Care Act doesn't care about your net worth. It doesn't see your multi-million-dollar brokerage account. It doesn't look at your paid-off house or the giant balance in your 401k. The system is blind to your wealth. It only cares about one thing, your modified adjusted gross income, or MAGI. This is the oversight that wrecks so many retirement dreams. People think that because they have a high net worth, they'll automatically have to pay the full, insane price for health insurance. They assume subsidies are only for people with low incomes, but that's just not how it works. In the world of early retirement, wealth and income are two totally different things. You can be a multi-millionaire on paper, but if you set up your finances the right way, you can have a very low income in the government's eyes.
Think of it like this. Your retirement portfolio is a giant warehouse full of money. The government doesn't tax you on the value of the whole warehouse. It only taxes you on the boxes you take out and open each year. Your MAGI is just the value of those boxes. If you can control which boxes you open, you can control your income. And if you control your income, you control your healthcare costs. This isn't a loophole. It's the rule of the game. And learning how to play is the difference between a retirement nightmare and living the dream. Number 3, the escape plan. This is where you take back control. Escaping the healthcare trap isn't about earning more or saving more. It's about being smarter with the money you already have. It's about building your retirement paycheck from the right accounts in the right order. Let's look at two identical couples. Both are 50 years old, both have a net worth of $2 million, and both need $100,000 a year to live their dream retirement. Scenario A, the trap, the uninformed retiree. This couple, let's call them Pat and Sam, did a fantastic job saving, but never learned the rules of MAGI. To get their $100,000 for the year, they pull it straight from their traditional 401k. Since every single dollar from a traditional account is taxable, their modified adjusted gross income is exactly $100,000. When they go to the ACA Marketplace, the system sees that high income and gives them zero financial help. They're stuck paying the full sticker price. Let's say it's $1,800 a month, or over $21,000 a year. Their $100,000 withdrawal just shrank to $79,000 in actual spending money. Over that 15-year gap, they'll burn through more than $300,000 on premiums alone. This is the nightmare. This is how a fortune gets drained.
Now for the second couple. Same net worth, same spending needs, but they planned ahead. They didn't just have one big pile of money, they built a tax-diversified portfolio. To get their $100,000, they don't touch their IRA. Instead, they sell $100,000 worth of stock from their taxable brokerage account. And here's the brilliant part. That whole $100,000 is not income. Only the profit, the capital gain, counts towards their MAGI. Let's say they originally bought those stocks for $70,000. Their taxable capital gain is only $30,000. Their MAGI for the year is just $30,000. When this couple visits the ACA Marketplace, the system sees that low income and unlocks thousands of dollars in premium tax credits. That same $21,000 a year health plan might now cost them only $2,000 for the entire year. They just saved themselves $19,000 in a single year, not by being richer, but by being smarter. They have the exact same lifestyle as the first couple, but get to keep an extra $19,000 of their own money. Over 15 years, that one strategic choice could save them over $285,000. This strategy gets even better when you have the right tools. A health savings account, or HSA, is the ultimate superweapon. You get a tax deduction on the way in, it grows tax-free, and you can take it out tax-free for medical expenses. Another great tool is simply having a few years of living expenses sitting in cash. By living off cash, you can create a year with almost zero income, maximizing your subsidies when you need them most.
Number 4. Building your financial fortress. So the big lesson here is that healthcare costs in early retirement aren't a fixed wall. They're a variable expense you can actually control. The solution is to stop seeing your retirement savings as one big pile of money and start thinking of it as a set of tools, each with a specific job. This is what we call tax diversification. The order you tap into your accounts is everything. You create your paycheck by pulling from them in this sequence. First, for the first year or two, you spend down your cash reserves. This creates a super low MAGI and gets you the biggest possible subsidies right after you leave your job. Second, you strategically sell from your taxable brokerage account. You carefully manage the sales to keep your capital gains, and thus your on-paper income, low, just like our smart couple did. Third, you use your tax-free buckets. This means pulling your original contributions from a Roth IRA or using funds from an HSA for medical costs. These don't add a single penny to your MAGI. And only last, when it makes the most sense, do you touch your tax-deferred accounts like your traditional IRA or 401k, maybe taking out just enough to fill up the lowest tax brackets. By building this financial fortress with taxable, tax-free, and tax-deferred accounts, you give yourself the ultimate power in retirement: flexibility. You get to choose your income each year, basically turning the dial on your healthcare costs up or down as you see fit.